Tansinite tempe, ke guanawaga magani, kiho kapa pimote, te guamestigwasti na basis no ihuen, onix kopuni cochinia, eataskian kinokamase, ke guamisquiti waskaigan, guatah caranto, maskiki we nuayan. Hi, everybody. I'm Dr. James Makokis. I'm from the Satellite Cree Nation, which is in northeastern Alberta on Treaty 6 territory. I work in Kinokamasik, Kihiwin Cree Nation, South Edmonton, doing transgender-focused healthcare, as well as in Toronto at the Shkaabe Makwa Center, which is at the Center for Addiction and Mental Health. As a medical director, I do many things with elders around traditional medicines and revitalizing the Nehiyo, the Cree medical system, which is part of my work that I love and is a full-time job in itself of constantly learning and rebuilding our own medical system, which is so important to our health and wellness and well-being. A lot of that is like going out into the bush and learning about medicines and being a helper, random ceremonies in the middle of the mountains or whatever. So I think those are some of the reasons that drew me to healthcare. I love working with our people, and I've wanted to be a doctor since I was probably about 4. I don't know why, but I think it was just one of those callings, and spent a lot of years in school to get to that point, like almost didn't get there. And it was actually the elders in our community that really helped me get through medical school by putting up ceremonies for me when I was really down. And now I spend a lot of time with them and helping to lift them back up into their place of where they should be in our nations and working alongside of them. So that's what inspires me, is to have hope for the future and have our health system be what our elders have always envisioned it to be.
Hi, everyone. My name is Dr. Lisa Richardson, and I am a mixed blood Anishinaabekwe. My community is called Shebahonaning, colonially known as Killarney. So I'm Anishinaabe of the Great Lakes, and I practice something called general internal medicine. And a lot of people say, well, what do internists do? And I say that my job is spent often in the hospital looking after patients who have multiple, complex, different kinds of conditions like diabetes or heart disease, breathing difficulties, problems with their kidneys, and how they all interact. And so when people come into hospital, I care for them there and try to make sure they have a good experience, and obviously care for them and get them home as quickly as possible and safely as possible. I love my job, and I love medicine because um, I love the science of it, and I love working with people and caring for people. And I think that that is a gift that we all have when we're in this role as healthcare providers. Um, and my passion right now, especially during COVID, has been working with our local Aboriginal Health Access Center called Anishinaabe Health Toronto, and looking at really innovative ways to make sure our people are supported during COVID. So doing COVID testing, taking a mobile unit out to many different areas where people are in the urban center, but not just doing COVID testing, doing all of the other, important aspects of healthcare, some primary care, but also song. And sometimes we have drum circle, and we have people of, elders and others present. So that's been a lot of what I've been doing in the last little while, and also vaccinating. So that's been inspiring too.
Tanse, everybody. My name is Shirley Bourgeois. I'm an exemption Métis midwife, and I practice here in Toronto. I was born and raised on the West Coast. My family has lived all across the prairies with ties mainly to the Red River, north and south of Winnipeg. I work as a midwife. I've worked as a midwife here in Toronto for almost since 2007. So In that time, I have worked as a registered midwife. And a couple of years ago, I gave out my registration with the college to start working under the exemption, which is something that's unique here in Ontario. And what that means is that I practice under the authority and the accountability of the community here in the city. Also, that means that the community gets to have input and decide what my scope of practice is, of course, within my knowledge, skills, and experience and what that means. And so, what that's done is actually provide lots of opportunity and has shaped a lot of the work that I've been doing over the last couple of years and has been very helpful in this time since COVID has started. So, one of the initiatives that we one of the initiatives that I started or that we started as a group when COVID first came about was April of last year. We started a hotline called the Call Auntie Hotline. And really, what we were thinking of when we started it is that I work with a group of community birth workers that provide extra support for folks who are birthing, because that's the kind of main group of people who I'm working with, and they're folks who will help just to provide that extra support and that extra care up until about 6 months. And when COVID first started, we were trying to think, and we were hearing from people what they needed, and some of the things we just wanted a way to be able to support the wider community to make sense of all the different public health guidelines that were coming out. We knew that we were already very good at centering self-determination as a way for people to bring about and participate in their own health. And so we wanted a way to be able to continue to center self-determination while providing that ear that aunties so often are so good at providing in problem solving, in trying to figure stuff out, and just trying to make sense of how do you self-isolate? What does it mean if I was exposed? What should I do? And we know that it's not just in the cities, but everywhere. A lot of our kinship systems can be quite fractured, and it can be a little bit difficult sometimes to find those folks close by or far away to call and work those things out with and have those conversations with.
So COVID-19 has impacted the way that I work and serve people tremendously. Almost immediately, we started going to virtual care appointments, which I've always done telehealth, but to have to do that for all of the care took quite a bit of an adjustment. And we were able to get some equipment in our clinic where I could see, the back of people's throats and in their ears and those sorts of things with specialized medical equipment, which has been very helpful. One of the things, because I'm a community-based physician and part of my role, and there's very little way in the term, there's very little in the way of medical leadership in a First Nation community that we very quickly had to mobilize a pandemic response team to make sure that we protected the entire nation. And part of this involved closing down the nation and having security and border patrol and all sorts of things to prevent the introduction of COVID-19 into the nation, because the resources that we have are very limited at times. And so we wanted to make sure that the people were protected as much as possible and that they had food and all sorts of things. Because of the limitations in areas to isolate, we had to encourage people to set up alternative spaces to do that if it did get into their home, like having their teepees set up or trappers tents or trailers or different spaces that they could go to protect other members in their family. What I saw was a renewed interest in our Nehiyo, our Cree medicine. So people were, frantically looking for different medicines that could help with this, and remembering what are some of the medicines that we used during previous historic pandemics, whether that was the smallpox pandemic or the Spanish flu. And it was very interesting to hear what the elders remembered from those pandemics. And one of the things that we know is some of the medicines that we use are located in the United States. and it's very difficult to access them. And so it becomes very important in terms of talking about our sovereignty and right to our own health system, that we should freely be able to move between these imposed borders to be able to bring these medicines back and forth across for our people to access and use. And those were some of the ones that our elders encouraged our people to use, is those same ones that got us through previous historic pandemics. Some of the struggles that I see people having as a result of COVID-19 are isolation, of separation, of drastic effects on mental health, and being able to gather, because when there is COVID that is introduced into the community, or people are naturally passing away from other illnesses, we're not able to support them in the ways that we normally would. So at funerals, what we've done is encourage people to, even though they might not be allowed to gather at the gravesite, that they can go and park on the road and demonstrate their support, or drive by people's homes to demonstrate their support and that they're with them as well. And so we've had to adapt to having different ways of showing people the support that they normally would get by having a traditional burial and those sorts of things. The other thing that has been a struggle for people is to be able to isolate effectively in a home where there's multi generations of families living in. And so what I've seen sometimes is, if there's a child that becomes sick with COVID, that the parents have to contract COVID to look after the child and put themselves at risks, which has been very difficult. And that's just one of the struggles that we see of having a young population and having many families living under one roof. In terms of support for people with COVID, some of the things that I do is a lot of reassurance that, that they should continue taking our own medicines, and that they should continue to use what they have available to them, in addition to what Western medicines we do have. And going over some of the signs of, if they're starting to become in trouble, if they're starting to have respiratory distress or trouble breathing, of when they need to go to the hospital. The other thing, unfortunately, that we've encountered with the pandemic is a manifestation or magnification of the racism that already existed within the healthcare system. So I've had to encourage people to be very strong advocates for themselves when they go to the emergency room, that they are seen, that their vital signs are taken, and they're not just turned away because they're from a reserve. And there's been a lot of advocacy efforts that have had to go into place to ensure that people receive the appropriate care.
So the COVID vaccines are very similar to a lot of the other vaccines that we have. They're actually, for people who get flu vaccines every year, it's almost, it uses very similar ingredients. And the way they work is pretty, there are two primary vaccines that we're using right now. One is called Pfizer and one is called Moderna, and they both work the same way. They use something called messenger RNA. And that's basically a way to get a message into your body's cells, to actually get your body's own cells to produce a particular part, a component of the COVID virus. So not the virus itself, but a little piece that actually sits on the outside of the virus. And your body actually creates that little piece using its own machinery that it creates for when it's creating all different types of proteins. And then what happens is, with that little bit of, it's called a spike protein, that your body has created itself in response to the message that it gets from the vaccine. And when that spike protein gets out into the bloodstream, your body actually responds to it by creating an immune response. And that immune response are actually the cells that then remember that spike protein, which is a part of COVID. So that next time, if ever your body should be exposed to COVID in real life, it actually already has the memory inside it, in its immune cells, to respond quickly and to destroy that virus as soon as it gets into your body. So it's the principle by which all vaccines work, and it's extremely effective. How is it different from other vaccines? As I've said, it's actually very similar. And the reason we were able to develop these vaccines so quickly, people say, well, how did it go? How did we create a vaccine in like less than a year? And it's because we already had the mechanism to do this. So as I said, the flu shot that you get uses the same kind of technology. It has the same structure. And all that the scientists had to do was actually figure out what component of the COVID virus needed to go into that vaccine, and then we were able to develop it very, very quickly.
So, in terms of how the COVID-19 vaccinations work, one of the ways that I describe to my patients is if you think about a long time ago when we had an enemy that we needed to protect ourselves and our people and community against, that there'd often be a scout that would go and learn about that particular group of people or enemy, learn their ways, and then bring that information back to the rest of our community and people. And they would prepare the Ogititaoskowak, the women warriors, the Napekasawinawak, the men warriors, to be able to know how to fight and deal with that particular threat so that it would protect everybody else. So if you think about what Dr. Richardson just said with the messenger RNA, that's kind of like that scout that's going out and learning about how, the COVID-19 works and the spike protein, bringing that information back to your body, to camp, and teaching your body, the warriors, the women warriors, the male warriors within that nation, how to fight it off so that your own people, your own body can fight that and protect you. So if you think of it kind of like Game of Thrones, if anyone's watched Game of Thrones, when they were learning about how to fight off the White Walkers, what they needed was dragon glass, right? And so they went to and mined all this dragon glass, and that was the secret weapon that they needed to fight off and defeat the White Walkers. And so that's what's essentially happening, is your body's learning how to fight off this new enemy and protect itself using its own information and the technology that's available in the vaccine. So it's not going to harm you. Sometimes what you might experience after you get the vaccine is when your immune system is waking up and realize how to fight that off. And you might feel tired or fatigued or have headaches and different things like that. But that means that the vaccine is working and your immune system is working. So that's a good thing to experience. Some people have more side effects than that. Some people have less side effects. But when you feel that, that is a good thing. And that doesn't mean that you're going to get COVID as a result of it. It just means that it's working.
One of the common questions people have asked me is, well, is it safe? Like, what are the side effects of it? And I think it is considered a very, very safe vaccine when we look at all of the other vaccinations that we get. So the most common reaction is actually that you get a sore arm, like right at the site where you get the injection. So about 80% of people will have some, like you'll notice it, the same way that you might feel it if you've had a flu shot or your tetanus or another injection. And then, you might feel the headache, you might feel some tiredness. And the really severe complications that we worry about with vaccine, which is having a severe allergic reaction, that's called anaphylaxis, when you can have difficulty with breathing. And in the worst case scenario where you would require something to actually try to open up your airway and you'd have to be taken to the hospital, that occurred in like 2 to 5 out of 1 million people. So it is, and that was the severe reaction, and it's very, very infrequent. So most of the immunologists and allergists, everyone, actually not most, they consider this to be a very safe vaccine. And I think that's something that I like to remind people about, because that's something that's come up. The other thing that's come up is, well, I'm young and healthy, and I'm probably going to be okay. Like, do I really need to get the vaccine? And that is really speaking to a few things that that we've already talked about, which is that this often, when you get this vaccine, it's not just about protecting ourselves, about you and the effect on your own body, but it's that you know that you can be with your loved ones, with elders and others who may have chronic illnesses and may be more at risk if they get the infection. And you know that you're protecting them by protecting yourself. So I think that's a really powerful idea. The other piece is that just because you're young and just because you're healthy doesn't mean you actually won't get COVID and won't end up with having a severe form of COVID. So I think we need to recognize that. Like, when I see patients who are in the inpatient wards, they're not all of an advanced age. Some of them are younger, and some of them have diabetes or have other illnesses that put them at higher risk, but some actually have no other condition. So I think it's important to recognize that this infection can affect anyone. And so it is recommended that it's given the highest priority. People are elders, but then we know that people who are living in other environments where they may be harder to isolate or harder to be set, where there's a higher risk of transmission, should be getting it. When I had the vaccine, I felt really relieved because I was caring for people every day who had COVID. And the fear that I had every day when I came home to my family and had to, I had this whole routine, like scrub down, take off all my clothes, make sure I wasn't wearing anything at home that I had worn in the hospital, was really quite intense. And I was so worried that I may have picked up a COVID virus and could transmit it to my children, my partner, without even realizing it. And that was like a real worry, let alone several people in my family who have cancer and are on cancer treatment. And so would be at extremely, extremely high risk of getting really sick if they got the infection. So although, I think all of those benefits, all of that relief was really what I felt when I got the vaccine. I also felt like I did have a headache and I felt a little bit tired. And after the second dose, it's known that you may have the symptoms maybe a little bit more, but as Dr. Makokis was saying, when your body's responding like that, you know that you're getting a really good immune response. So I was a little more tired after that second dose, and that's common. But overall, it was a good experience.
So some of the common questions and concerns that I hear from people in the community about the COVID vaccine is that they don't want to be considered guinea pigs, or they don't want to be guinea pigs. And we have to understand where this comes from, because in our history with colonization and genocide, that there has been processes, there have been times in our history where our people have been experimented on, whether in residential schools with nutrition experiments in children, or with the development of the BCG or TB vaccine and the Fort Capel Indian Residential School Hospital, or the sterilization of Indigenous women against their will in hospitals that have continued up into 2017. So there's very good reasons why people are hesitant of taking the vaccine that we have to consider and that we have to take into account. Now, having said that, it's very important for our people to get the vaccine. It's very important to protect our elders in the community from getting COVID, and especially the rest of the people in our population, because there's so few knowledge holders now. There's so few people who speak our Nehiyo, our Anishinaabekwe, the Cree, the Ojibwe, all the other Indigenous languages. And we want to make sure that they are around for a long time so that people like us can continue to learn from them, because we have so much more to learn. And so when you get the vaccine and you take the vaccine, it makes my job as a family doctor so much easier because there's less people in the community to have to worry about. There's less people in the community that can potentially transmit the virus and cause us to have to react to that. So I'm very excited about the possibility of, I haven't received the vaccine yet. I'm looking forward to it. I'm glad that our elders in Kitsiasu Tamwa and Nagutuasik, Treaty Number 6 in 1876, agreed to have medicines into the future, that our people would have access to them, because we knew that technology would evolve and we didn't have things that we do now. And this is exactly the reason why they enshrined the pestilence and famine clause into our treaty, to protect our people when times like this come. So I'm glad they had the vision and foresight to do that. And I will be signing up and getting that vaccine injected into my arm as soon as I'm able to. And so will my husband and family.
One of the things that of the conversations that we had in our practice, which stuck with me through this pandemic, is that we talked about how resilience implies, how we're also resilient, and we talk often about how resilient we are as a community. But at the same time, resilience implies that you've had to go through some sort of difficulty to be able to become resilient. And so thinking as a group of midwives and as a group of, taking care and within community when we're in community, is it that we want to both celebrate the resilience, but we also want to celebrate and hold up even higher the support that we show each other in these times of difficulty and in these times of need. And so recognizing, even however small it might be, the kindnesses, the care, the love that we're able to show each other, even if it's just, dropping something off at someone's house, calling somebody on an afternoon, sitting down and having tea over Skype or Zoom, delivering some food, sending a text to somebody who is on their own, in different times, like sitting across from a fire from somebody and visiting. Any of these kindnesses and all these things that we do to support each other is really the thing that, as a group, we really wanted to recognize and hold up. So I hope all of that for everybody on here as well, that you're getting all those kindnesses and love coming your way.
I guess one of the things I would say is I got my vaccine, but I also have my medicine pouch. And I think I see that, as we were talking about earlier, these are different forms of medicine, and they're both important from my perspective. So practicing our traditional medicine, in whatever way you may do that, is really important to continue. And that doesn't mean that you can't get the vaccine. And similarly, if you're getting the vaccine, doesn't mean you can't be using our own medicines. And so I see that, I see them working. I think it's important for me personally to be able to do both.
Yeah, so I think one of the things that I've learned during the time of the pandemic and having to isolate from elders and knowledge keepers and people that normally help us maintain our traditions and identity and ceremonies and spirituality is it has really forced us to be independent in being able to carry out those practices ourselves. And we have been taught so much by our elders for all of these years that we have to have the belief in ourselves to know and trust what they've taught us, that we can use them to look after ourselves and our families. And so I think that's one of the lessons for me of COVID-19 is to be more independent in our spiritual practices in our home, and trust that we are doing the right thing in a good way to look after our own home fire. And we have all of the medicines, we have the knowledge that has been passed on to us that we can now use to protect ourselves, our mental health, our emotional health, our spiritual health, and our physical health. And that is one of the teachings for me about why COVID-19 has come here, has really ignited that for our people. So it's exciting to see so many people using our own medicines and learning our own ways and becoming more independent, because I think that is what we need to do.
So just Kanans Gomten for having me here. It's been really nice to spend the time with you guys. And I'm really looking forward to, I'm going to say late summer, when many people have been vaccinated and the sun is out and we're all able to gather together in big groups in the park, even if it's distance, but to be in the same place with each other once the vaccination has really had its chance to come to everybody.
I always reflect on, what our elders teach us and what we hear in ceremony all the time is Akamemuk, don't give up, keep going. It's not going to last forever. And I too look forward to the summertime when we can gather and get together again.
Wishing you all care, kindness for one another, and that you're looking after your mind, body, spirit, emotion, as we all need to do all the time, but as COVID has made even more apparent to us. Miigwech, so honored to be here with these incredible people.